Welcome to the University of Pittsburgh's Health and Explainable AI podcast. I'm your host, Jordan Gass-Pooré, a health and science reporter. Join me as we cover advancements being made in health informatics and explainable AI for students, researchers, and healthcare practitioners interested in applications of artificial intelligence and machine learning. This podcast is produced by the University of Pittsburgh's Health and Explainable AI Research Laboratory at the University of Pittsburgh School of Health and Rehabilitation Sciences Department of Health Information Management. Headed by Ahmad Tafti, Pitt's HexAI Lab cultivates extramural collaborations with academic institutions both nationally and internationally through its research, educational contributions, and this podcast series. I'm Jordan Gass-Pooré, your host, and today we're going to speak with Yanshan Wang from the University of Pittsburgh, who's a vice chair of research and an assistant professor within the Department of Health Information Management. Dr. Wang's research interests focus on artificial intelligence, natural language processing, and machine and deep learning methodologies and applications in healthcare. In 2025, we thought we'd learn about Dr. Wang's work and research interests and hear his views on the types of cutting-edge research we're likely to see in 2025 across the healthcare field and coming out of the University of Pittsburgh. Welcome, Dr. Wang. To get us started, would you like to introduce yourself and tell us a little bit about your roles at the University of Pittsburgh?
Thank you, Jordan, for your kind introduction. Hello, everyone. My name is Yanshan Wang. I'm the Vice Chair of Research and Assistant Professor of Health Informatics in the Department of Health Information Management. I'm also serving as the interim Director of Generative AI at the CP's AI Center at the University of Pittsburgh School of Medicine. I also have several other secondary appointments in the Intelligent System Program, Department of Biomedical Informatics, and Clinical Translational Science Institute. And I'm also the current chair of the American Medical Informatics Association, FAMIA, Natural Language Processing Working Group. I'm very happy to join this podcast. As Jordan mentioned, my research mainly focuses on artificial intelligence, natural language processing, machine learning, and nowadays generative AI and large language models and their applications in the medical domain. So yeah, that's about me.
So it sounds like you're very busy.
Yes.
All right. Well, I'm curious just to kick things off too about what got you first interested in health informatics and artificial intelligence.
Mm-hmm. Yeah, that's a very good question. I joined Pitt 3 years ago from the Mayo Clinic. So I joined the Mayo Clinic as a postdoc in 2015, right after I got my PhD degree. And my educational training was actually in computer science. And before I joined Mayo Clinic, I had zero experience in medicine or healthcare. And my entire PhD and my entire educational training was in very theoretical computer science and natural language processing, very general natural language processing. But around 2015, there are a lot of job openings, and also the data in healthcare explode exponentially. The reason is in 2009, President Obama signed the High-Tech Act into law, which makes many healthcare systems to digitalize the electronic health records. And at the beginning of the age, the digitalization of healthcare, electronic health record, the EHR data, is mainly to streamline the revenue cycle, reimbursement, also hospital administration. But after 5 or 6 years, around 2015, 2014, there are so much digitalized records generated from healthcare, and the healthcare system start to think about how to leverage those data to improve patient care and also facilitate clinical and translational research. So that is almost the time there is a lot of enthusiasm, how data science at that time, AI or generative AI is not a buzzword, yet. So people start to think about data science techniques to mine gold from the electronic health record. And that's why I end up with the postdoc position at Mayo Clinic, and experience there enabled me to utilize a lot of the computational techniques I learned during my PhD, like information retrieval, information extraction, optimization theory, and combine those computational techniques and the real-world data from the EHR to solve the real-world medical problems and facilitate physicians, clinicians, their research, decision-making, and ultimately, of course, improve the patient care. And as you may know, the Mayo Clinic slogan is the needs of patients come first. So when I did almost every project there, I always keep that in mind. What I'm doing, quite very different from traditional computer science. Because in the traditional computer science, you try to solve an upper bound of an objective function in optimization problem, which is not not very close to a real world problem. But in the health informatics, what you are doing can really improve patient care, maybe next day. So that is really the difference, I learned there, and that's also my enthusiasm in the health informatics and biomedical informatics. And I continued my career in biomedical informatics.
Dr. Wang, can you tell us a little bit more about your role as Vice Chair of Research and sort of what your day-to-day looks like in that role?
Yeah, so my vice research role in the Department of Health Information Management basically oversee the health informatics research in our department. My entire career has focused on biomedical and clinical NLP to improve patient care. I collaborate with many domain experts like physicians, clinical researchers, and use NLP to solve the real-world problem. So in my role as the vice chair of research, I try to figure out what is the overall picture, of the research in our department, and how can we, as a department, how can we include the different expertise from different domains in healthcare to improve patient care and healthcare as a whole. For example, once I step into my role as a vice chair, we start to realize we need, somebody who specializes in AI transparency and equitable AI solutions. And that's why we hired Ahmad P from other university to figure out those transparency techniques in AI, and they also figure out a lot of applications that are oriented to improve patient care and also for the patient who can use those applications at home. So design those applications and consider the customers and patients at the center of the application design is also very important. So the second faculty we recruited is Dr. Yun-Tree Choi from UC Davis, and he bringing a lot of design thinking, mechanisms into our department research portfolio. So at the department vice chair, right now we have experts in human-computer interaction. We have experts in telemedicine, mobile health. We have experts in machine learning using the structured data. And myself, I'm an expert in in NLP using the unstructured data. We also have Dr. Tafti focusing on transparency, equitable use of AI solutions. We also have Dr. Tree focused on the HCI, which is more like front end design of the AI applications. So we are more like full stack team and focusing on from the very back end to the front end to innovate the entire healthcare system and bring the AI and also all those computational technology to, in front of the patients to improve the care. And that is our basically our objectives in our department.
So normally we talk about explainability toward the end of the episode and getting your thoughts on explainability, but I think this is a great time to ask now since you brought it up. What are your thoughts on explainability and especially going into 2025?
Yeah, so that's a great question. So before in talking about explainability, I actually want to talk about the ethical considerations in the AI application in healthcare. So when there are a lot of enthusiasm in the community how to use AI in a lot of medical applications from from when the patient entered to the healthcare system, people start to think how AI can be used to automatically schedule patient appointment, how to reply to patients, message in patient portal. And then when the patient sees a doctor, how AI can help doctor make a decision, how the AI can, automatically generate the clinical documentations. But a lot of those applications actually lack consideration of ethics. The reason is, a lot of our application, are driven by a lot of tech companies in this domain, right? So for example, if you think about it right now, those big generative AI models like ChatGPT is, developed by OpenAI. and those Llama model developed by Meta, and of course Microsoft also have access to OpenAI's ChatGPT, GPT-4, all those models. So those models are actually, developed by those tech company, and they want to apply those models in the healthcare domain and quickly generate revenue. But in the healthcare domain, it's really care the patients and also improve the public health. And there is a different from the general domain. People may use those model to maybe for entertainment or use the model to filter emails, right? So that's why there are several ethical concerns when those AI applications are adopted in the healthcare domain, without a serious evaluation or without a serious consideration of those ethical principles. And actually, in the previous year, we think about this issue and also explore some ethical principles from different domains, like from the military perspective, from the healthcare, from the software development perspective, and we explore and propose some ethical principles. We name that as a Great Plea ethical principles. So basically, we created this 9 ethical principles, and we take every first character from each principle as acronym Great Plea. So it stands for governability, reliability, equity, accountability, traceability, privacy, lawfulness, empathy, and autonomy. So those are the 9 ethical principles. And when you talk about transparency, actually falls under one of the principles, which is the traceability and also accountability. So let's talk about the traceability. Right now, all those generative AI models, we don't know where those generated content come from, right? You ask a question, you ask the generative AI to generate some answer to a question, it might be a medical, question and generate some answers, but we don't know where those, answers come from. What is the evidence? What is the reference for those generated contents? And the more ironic is that some of the AI models could add a reference to the generated answers, but those references are made up by those AI models. So that's also related to another problem called hallucination. AI hallucinate and made up things. The reason is we don't have a traceability. We don't have a transparency in the current generative AI models. And if we don't have those transparency in AI models, that will impact the other principle, which is accountability. How can you, make sure the physicians trust AI? And how can you make sure that the patient trust AI? And it's very important to build those mutual trust between physician and the patients. And if AI is used in this interaction, how would that impact the mutual trust, between physician and patients? So those are all unsolved problems. And of course, it may also end up with equity as well, right? Because if the AI has no transparency, we don't know how that performs for underrepresented population, why it performs badly, not consistently for underrepresented population, because we don't know what is going on inside the AI model. So then it will end up with some equity issues. So those are many, many considerations in the AI model. And that's why we really need to have a better transparency approach to understand what is really going on in those generative AI models.
Well, I'm curious too, how do you get that transparency when that you discussed when you're working with these big tech companies that aren't necessarily beholden to you, they're beholden to themselves or other outside factors. How do you get that from them?
So theoretically, those AI models are trained not for the purpose of being transparent. So basically, you see all those AI models are based on hundreds of layers of neural network. Like all those large language model are built on transformer and block, and each transformer block are built on many layers of deep neural network. And those deep neural network actually do not have transparency in itself. So a lot of research study actually try to use interpretable approach, for example, decision tree, to simulate what those deep neural networks doing, and then use that approach to approximate deep neural network and try to interpret the deep neural network. But as far as the deep neural network itself, it does not have the transparency, how it come up with the final decision because there are just too many layers in between, right? So in theory, it is, transparency is not there. It's not designed for interpretability. But the thing we brought up this transparency is at least we need to have a very comprehensive evaluation plan. We have to rigorously evaluate under what kind of situation the AI model works and under what kind of situation the AI may not work. So for example, if we use data from the healthcare system to train those AI models, we need to understand, what kind of race population, what kind of, ethnicity population this AI model may work, to the performance that is acceptable. And for other underrepresented population or for some socioeconomic, underrepresented population, we need to evaluate those AI model performance on those population and give them like a flag. Okay, this AI model may generate a biased or performance or biased result on those population, right? So we need to do very comprehensive and a very detailed evaluation on those AI models. But right now, those AI models has been used without even evaluating them on very comprehensive evaluation. So some people even say when doctor go to a practice, they need to pass many board exams. So those AI models, they can pass board exams, but are they eligible to provide care? Because the care is quite different from answering those board exam questions, right? So that is really some more consideration, more research need to be done to really fully use AI. And I also want to mention that in like 1800, early 1800, people, discovered radium, which is a new element that can treat cancer, right? And actually, Marie Curie actually got a Nobel Prize because she discovered those radium. And the people later used radium to treat cancer, to treat many disease. And people didn't realize the radioactivity, those may harmful to people's body. And at that time, it's very funny that people add radium to many daily products. You can see there is some shampoo with added radium. There's some, soup with added radium. And then, and one famous example is the glow in the dark watches. They add radium there. And a lot of the factory workers, when they make those watches, they actually use their lip to put some radium into the tiny piece in the watch. And those workers actually, of course, people did more research on those, radioactive elements. And after 30, 40 years, people realized radium may be harmful to people's body. But those workers already suffered from exposing themselves to radium, and they actually had very severe disease after that. So right now, go to nowadays, people are using AI, and without evaluating AI, AI has been used, maybe widely used in healthcare. Maybe after 20 or 30 years, people may start to realize AI is doing harmful things to people's health, right? So I just also read a news, I think, I don't know if it's true or not. So this is just a disclaimer. So, the United Health CEO was murdered, in New York. And there was a news that United Health was using the AI algorithm to whether approve or deny some medical claims. And some news said the AI algorithm has a very high error rate. Okay, very, very high. So I don't want to reference the number, but very high. And think about that. So if those AI algorithms are used in our healthcare system without, very comprehensive evaluation on different population, on different, subgroups, it may end up with a very serious disaster for our healthcare. So that's why transparency, all those ethical principles are very important when we think about AI, AI application in healthcare.
Unlock the future of AI at Pitt HexAI. Pitt HexAI is where the brightest minds at the University of Pittsburgh come together to push the boundaries of artificial intelligence. Tune into to the Pitt HexAI podcast to hear experts discuss cutting-edge AI research and its real-world impact. Join us at Pitt HexAI and listen to the podcast today.
Well, I'm really glad that you mentioned the experiences with radium in the past. I do a lot of work in New Jersey, and New Jersey is home to the quote radium girls and the case with them and the things that they suffered. And so I'm familiar with a lot of that. Well, it sounds like we have a lot of challenges moving forward in 2025 and beyond. But I'd love to hear on a more positive note about what you're excited about moving forward in 2025, whether that's your research or other aspects of health informatics and or AI.
Yeah, that's a great question. So my research right now has focused on generative AI models using the electronic health record data we have at our current healthcare systems. And so, in the past week, there's a big conference, NeuroRips conference, happening in Canada, and the previous OpenAI co-founder, talk about the end of pre-training for large language model in generative AI because they think we have computing power, but now the data is not enough to train more powerful large language models, and they call the data as a fossil fuel of those large language models, right? So in the healthcare domain, it's quite opposite. We have a lot of data. So in the UPMC, we have hundreds of millions of patients' data. We don't have computational resources to train the general large language model. Of course, because of the HIPAA, legal issues, and because of that. So in 2025, I think, of course, also my interest, I want to bridge the gap with, bring more computational resources to our healthcare system through the NVIDIA partnership with Pittsburgh and also with the Carnegie Mellon University. And we might bring more computing resources as well as NVIDIA, the talents, data scientists, AI scientist talents, to the healthcare domain, and then try to solve those cutting edge problems in the medicine by training our own generative AI models. And I predict there might be three directions we could do. One is the foundation models in the healthcare domain. So foundation models is basically using those vast amount of data, including but not limited to the unstructured EHR data, structured EHR data, and multimodality data, genomics data, omics data, imaging data, and all this kind of data available in the healthcare domain, and then train, big foundation model that could predict, for example, the treatment outcome. For example, there is a breast cancer patient, and there are a lot of immune therapy. What would be possible treatment outcome if we apply this immune therapy to this patient? Okay, and we need to use those large, gigantic foundation model to incorporate as much data, as much dimensions of data as possible in the model to make accurate prediction. And this initiative between Pittsburgh and NVIDIA will make that possible. The second direction I'm very interested in, also I predict will be the future direction in health informatics, is a generative AI multi-agent system. So as you may know, in the healthcare domain, there are so many problems. So for example, I just mentioned, the cancer. Cancer is more complex. So if you think about the cancer diagnosis, it's quite different from cancer treatment, and then quite different from treatment prediction. Also, if the patient is a metastatic patient versus recurrent patients, those are the treatment and the diagnosis all different. And at the end of the day, we might need multiple agents, and each of the agents will tackle the problem with perfect performance. But we put all those agents together as a multi-agent system to tackle one healthcare problem. And it's actually mimic what we're doing right now in the healthcare system. like we have a patient, and the patient went to the procedure, and the physician may take a biopsy and collect the specimen, and then go to the pathologist to make a diagnosis, whether the tumors, tissue there, or the common tissue, and then the tissue diagnosis result will go back to the physician. Physician will make the diagnosis, and then think about the treatment plan for the patient, right? There are multiple, it's team science, basically. So multi-agent system is also team science, should be act as a team science. There are multiple agents, and each agent is doing what they are good at in the, to tackle the healthcare problem. Some are good at diagnosis, some are good at treatment, some are good at even picking the locations or scheduling, schedule for the patient, right? So it must be a multi-agent system, and we use this multi-agent system to solve the healthcare problem. So that might be the second, biggest direction. And the third biggest direction is actually the data issue we are facing right now. So right now in the States, there are so many healthcare systems, and all those healthcare systems, they don't talk to each other, okay? And they own their own data, and they don't talk to each other. There's very difficult to share the data, and very difficult even to validate the model from one system to another system. Because if you develop the model in one institution, when you move the model to another institution, the data collection is different, the data standards is different, and you cannot imagine how different it is. For example, semantically, some data elements made the same. Like if you test your glucose, 40-hour, 24-hour glucose, in some institution, it means, in the database, the data elements may saved as a glucose 24-hour. In another, health institution, it may save it as a glucose 1 day. Semantically, it's the same thing, right? But the name is very different. And when you combine the data together, then you end up with different columns, and it is very human, very labor intensive to harmonize and standardize all the data elements. So I believe in the 2025, or maybe in the more future, I believe there might be national initiative to harmonize and standardize data from, may not be entire nation, but many healthcare systems, to make all the data standardized and harmonized and sit in this centralized place that can be used to train AI models, to validate AI models to do many things. So this data initiative, I believe it may happen in the future. And it's also my hope could happen in the future.
So once more, you did touch on a question or an answer to a question that we were going to ask you later in the episode, but I feel like it's a good time to ask it now. That I understand you're a professor, and so you work with a lot of students. Mm-hmm. And on this show, we like to offer our guests an opportunity to share a research project idea with students. So I'm curious if there's something you'd love to see students work on.
Yeah, absolutely. I think as students in health informatics, you have to keep your hands on many, practical projects, because healthcare is really, has data from the real world, and it's very different from, let's say, computer science, because usually they have well-defined data, well-defined outcomes, and you just work on the model part. In the healthcare domain, most of the time you have to collect the data by yourself, and also analyze the data, clean the data by yourself. And almost 70% of the time you spend is processing the data to make it, workable. So I would recommend, there are actually many good data set, and also many good platform students can use that are sponsored by NIH or the federal government. There are two I can think of. So any students can access those data platform and also use the data there and build your data analysis. So one is called All of Us study, All of Us data platform. And there, NIH, basically there is a precision medicine initiative in Barack Obama's, era. And then they initiated this All of Us. The goal is to collect the data from 1 million Americans and then put all the data in this platform. So data includes genomics data, electronic health record data, socioeconomic data, all the data there. And every student, as long as you are affiliated with Pitt or any other university, you can get an account, and then you also have like $300 or $400 credit. And those credits are far enough for you to conduct any analysis. Build your model there as well. A second data is called N3C dataset. N3C is basically national cohort of COVID, something like that. It's a big dataset collected during COVID, and it is a dataset of COVID patients, and they try to understand the long COVID symptoms and also some treatment for those COVID. And the students, you can also get access, similar to all of us, you can get access to the data and the data platform and do your analysis there. So those are some data sets and a platform you can use to do different projects. But your question, before using those data platform, your question must be something meaningful in healthcare. So for example, I want to figure out I want to predict the onset of COVID using the patient's insurance data or using the patient demographics. Some very concrete, very meaningful question to you want to answer before you use those software, those platforms. And if you are not trained in the medical domain, you probably want to find a collaborator to validate your question is really something useful, and you may need to do some comprehensive literature review to find a meaningful research question. So a lot of time I find finding the meaningful research question or finding the meaningful question is way more important than of course, data set is also important, particularly in the healthcare domain. You have to have the data set, and then you think about a question that can be answered by the data set, okay? So some students may have a question like, okay, I want to know how to treat patients with the patient that goes to the moon, something like that. And there's no data to answer that question. So you have to make your question practical, realistic, and it can be answered using the data set we have access to. So those are two major data sets, very large, very, very large data set. You can come up with many, many questions you have.
Before we close, thinking about research projects, and thank you for laying out some ideas for students, but really thinking through about how do you set up a research project and sort of the steps you take and what's going on the back end, because I'm sure there's a lot of steps that people don't see while you're working on a research project.
Yeah, that's a great question. I think for many students, I would recommend there's several ways. Number one, I recommend students to go to some health informatics conferences and then learn what people are doing in this community, in this domain. And then the students may get some idea, what are the topics they are interested, and what are the problems and the models, the most up to state-of-the-art methodology to solve those problems. And they can really quickly pick up things from attending those conferences. And number two, also reach out to your advisors, professors in your university, and also there's some open problems in some many companies. They reach out to those people who have a long experience in those problems and identify which problem is more significant and also more realistic to solve. And number three, there are actually a lot of we call that a shared task. So shared task means it's like a challenge. So people, for example, track TREC is a very famous challenge in information retrieval, and there is a clinical trial track in that shared task. People working on identifying the clinical trials that are eligible, that are suitable for a given patient. So usually those shared tasks, the organizers will provide you the data set as well as the labels and also the evaluation matrix. It is a well-defined shared task, and the students can work on those shared tasks. And you maybe just use the data from past shared tasks or participate in ongoing shared tasks. Will give you a very well-defined problem, well-defined data set to work on. So those are many different ways to find research projects. As a faculty, of course, we have many things to think about when we establish research projects. And as a faculty in the health informatics course, number one issue is how to make the project fundable. Okay, so because we have to have funding to fund our students and also fund those projects. Without funding, nothing could happen. So, but a good idea may not be a fundable idea. So that's why a lot of times we have to think about what ideas are fundable, what ideas are the priority from NIH perspective, from DoD perspective, and also how that meet my interest, because I don't want to work on some ideas that I don't have interest in, right? So at faculty, actually, that is more complex, and also we need to think about what the resources we have in the university. As you mentioned, computing resources might be something that not every university is like University of Florida has like 100,000 GPUs donation from NVIDIA. We're hoping we are getting there through this NVIDIA initiative, but with very few universities like that. And even the university has 1,000 GPU, it may not be allowed to put electronic health record data there. So there are a lot of things to work on and to solve in the healthcare domain, in the health informatics domain. And that's also the realistic. So not many healthcare systems has GPUs. Even one single GPU, not many healthcare systems have access to that. So that's why when we think about our methodology, we also need to be realistic that, okay, we develop a large language model, but then that can only be used in our institution because we have access to GPU. Other institutions don't have access to GPU. So that's not something workable. And in NIH perspective, they may not fund something like this because your methodology is not generalizable to other institutions. So all the approaches, all the ideas, problems we need to solve, actually there are many things to consider at the professor and the faculty level. But I would recommend students, if you have access to professors and the faculties, just talk to them, and they will give you a lot of ideas to work on.
So we always love to have some space for our guests to be able to give any shout outs or to pitch any projects that they may or may not be working on or things that they might want to do. And so I just want to allow you to have the floor if there's anyone you want to give a shout out to or anything you want to say in closing.
Yeah, absolutely. So we have a health informatics program. We have a bachelor degree and a master degree. Those are degrees we can offer in our program. And we have very comprehensive curriculum for our students, and all the students enter our program and have all the hands-on experience with the different courses, different faculties, and also students can work in faculty's lab. So just, health informatics program in our university and in our department is a very top-ranking program, and we have a lot of interesting research projects going on as well. So yeah, thank you so much.
Dr. Wang, it's been a pleasure speaking with you today. I really appreciate you taking the time, and thank you so much for joining us. Thanks everyone for tuning in and for following the show. The Health and Explainable AI podcast is produced by the University of Pittsburgh's Health and Explainable AI Research Laboratory at University of Pittsburgh School of Health and Rehabilitation Sciences Department of Health Information Management. I'm Jordan Gass-Pooré. Thanks for listening.